Hello dear friends, my name is Nazaruk. I'm a dentist from Ukraine, doing mostly prosthodontics in my office. As you can see on this slide, I work in Ukraine, western part. The city where I work is Ivano-Frankivsk, and the person I cooperate with is my father. He's a dental technician already more than 15 years. So today, what we're going to talk about is preparation for full crowns, microvision approach, minimally invasive, because quite often, as we see in our life, we don't know, or we might not be so sure about which kind of bird to use, what kit to use for preparation, and what protocol. I mean, if we do veneers, if we do metal ceramics, if we do a full ceramic restoration, what kind of bird to use, what speed, how much irrigation, and how much to push, and other details. So today we will try to describe the full protocol step by step with the videos, with the pictures, how we can improve our daily work. Kind of, kind of often we have been asked about the precision, like how precise we should be. Do we need to use some magnification? Of course we do, because nowadays we want to work more and more precisely to get a better result. 0 microns, 300 microns. What to choose, which way to move. Actually, if you want to be the best, if you want to improve your work, if you want to do the best thing for your patient, you have to be as precise as possible. 0, of course, is the best, and of course we know it's not possible. But if we have approximately 50 microns, the precision of our crown in the margin will be successful. That's why we have to try to do our best to gain this result. We'll try to describe the protocol of preparation and the protocol of work used in this clinical case. As you can see on this slide, this patient came to our office because she was not satisfied with her look, with the frontal teeth. We can see that the smile is not so perfect, and the girl is only 29 years old. Of course, she doesn't like it and she wants to improve it. If we look on the position of the lower lip, we also can see that the form of the teeth is not correct, and the reason she doesn't like is more obvious on this picture also. Let's look closer. We see the bonding on the lateral tooth on the right side. Also, we can see lots of leakage on the left side. We see that the teeth are kind of dark and the composites are very old. Also, for the analysis, we use the polarize because they give us few advantages. They completely eliminate glare and enhance contrast and saturation. So we see all the details much better. Like on this picture, you might see the cracks on the central on the right side. Also, you can see the halo effect. Also, on the left side, you can see that the brightness of central and lateral is much lower than the neighbor teeth. This is a very important information for our dental technician if we plan, for example, to use free metal ceramics, because the way of layering will be totally different for these two sides. Of course, nowadays, if you want to treat on a high level, you're supposed to see what you're doing. Those times when we were saying that for a good treatment, you just have to feel, now it's not really correct. You always have to see and control what you're doing. That's why we recommend to use binoculars or microscope. If you want to try binoculars, there are two systems, Galilean system and also Kepler system. Galilean is more recommended for the people who don't have an assistant, they work by themselves, and Kepler is more useful for people who have an assistant so they can concentrate just on the field where they work. Of course, the best thing is to use a microscope. This is actually the thing that I'm using in my daily practice. It gives us plenty of pluses. I mean, starting from the good level of documentation, we can make pictures, we can also do videos, we can analyze our work, we can show our work to our patients, and of course we can communicate with our colleagues, with the surgeon, with the endodontist, with the guy who's doing restorative dentistry, with everyone, with dental technician, of course. About ergonomics, few words. Usually when I work with the patient, I sit on 12 o'clock and there are a few screens in the room, as you can see. One is for my assistant, the other one is for students who usually come to our office to watch what we are doing, and also the patient. Patient is always watching what I'm doing on the screen on the video camera. So if it's interesting for him, he can see all the details. Beside that, I also use the chair to support my hands, my elbows when I work with the patient, so I'm relaxed as much as possible during the procedure. As I told you before, most of the time I sit at 12 o'clock and sometimes I move to 9 o'clock. And when I sit on 12 o'clock, I can basically see all the parts of the mouth. So all the procedures I do with the microscope, and this is the most comfortable position. If you are going to use the microscope or some kind of magnification, or if you even don't use a microscope, my advice to you is to use this kind of position. Quite often people ask if I do everything with a micro. Actually, the question and the answer is yes. Because with the microscope, even on the smallest magnification, you can see the full mouth. So all the procedure in the mouth I do with a microscope. Because I get few advantages. As you can see, we have better vision of details, more precise control, healthy position because we always sit straight. We don't need to pull our back to different positions. We are always straight in one position, in a healthy position. And we have very good possibilities for documentation. As you can see, when you use no optics, we have 70-degree position of our neck. When you use a microscope, you're totally straight. So let's protect our health. Where do you use microscope? Let's get back to our case. Usually, people I use the microscope is like an endodontic tool. And I don't agree with it because microscope is just magnification. You can use it everywhere you want and everywhere you need. Starting from patient examination, like in our case, when we see all the problems much closer and it's easier to understand how we can help the patient. Then going with endodontic treatment, the root canals, of course, it's very hard to be successful in this micro approach, micro access, when we want to be as useful and when we want to be successful when we do endodontic treatment. Of course, it's restorative when we do build-up, when we do direct restorations, and prosthetics. All the steps starting from the preparation, then controlling the impressions, also bonding the restoration that we do every single day on our work. So let's look closer. Examination. We can see that the roughness of the material is already not good. We see lots of leakage, many problems we need to correct. The bonding on the right side. So usually clinical analysis of the patient, we start with the extraoral. Even though I'm a big fan of microscope, I'm a big fan of magnification, all the details, usually when we start checking the patient, we start with extraoral, the face, the parts of the face, and only then we move to intraoral, checking the teeth of the patient. We make lots of photography, we also make lots of videos, so we can work with it in further planning of our patient treatment. As I told you, microscope gives us big advantages in this case. So, what we control with the microscope? Soft tissue after finishing our preparation. Also, final polishing of the margin. We see that there is no defect and we are finally and ready to take an impression. Also, the precision control of our constructions. Video documentation helps us to see our patient in dynamics. Before treatment, during the treatment, and after. So we can compare before and after, and also we can analyze our work while we are working with the patient. Let's back to our woman, our girl. That's what we plan to get as a final result in the end. So, with this form, we get a wax up, we send the previous picture to the dental lab so the dentist sees what he needs to correct. As you can see on this picture, we left two centrals a little bit rotated to each other because there was no too much place between two laterals, and also the patient was used to this kind of form of the centrals and she wanted to leave them like this as it was before. After that, getting ready to some preparation, getting ready for the further steps, I made the silicone key. For the silicone key I use a silicone because it's very strong, it's very hard, about 60 to 80 shore points, because stronger it is, harder it is, it's better for the prosthetics because it's more stable. Now we move on with the preparation. We need some rotating instruments. On the market we have plenty of rotating instruments and sometimes we get lost which one to use, which one we prefer. I was also analyzing many instruments on the market, and after trying different kits, different approaches, I created my own kit that actually looks like this. In the kit we have approximately 10 instruments. Which instruments we use for what? On the left side you can see 1 millimeter, then you see 1.4, then 1.6, then 2.3, 1.4 and 2.5. So 1 millimeter burrs, upper one is blue, the lower one is red. We mostly use for preparation for veneers and also full ceramic restorations. 1.4 we use for the press ceramics and also zirconium. 1.6 is used for PFM. Each of these burrs we use only the half. So in the first case we have the margin with 0.5, in the second case 0.7, in the third case is 0.8. The burr 2.3 we use for the palatal part of frontal teeth. 1.4 in the right upper corner we use for separation, and 2.5 in the lower row in the end we use for preparation of the cusps. Usually the full process of preparation we divide in two parts, the first phase and the second phase. If we work with the vital teeth, we have to control and we have to remember 4 rules. We always use just new burrs. Also we need enough water irrigation. We need approximately 44 milliliters a minute. How we can measure it? Just take a handpiece, just push gas, take some glass and look how much water you gain in 1 minute. If there is too much, you reduce water. If there is too little, you add water. Use gentle pressure, don't press too hard, and don't allow your dentin to desiccate. If you use these 4 rules, you'll be successful with vital teeth. You will not get pulpitis, or the percentage of the failures will be much less. Also, in the first phase, we recommend to use up to 70% of power of your handpiece, not more. Because if you use 100 and you push hard, you might get those cracks in the enamel. You can see them with a microscope. And when you go to 70%, the amount of cracks is much less. In the second phase, we usually use the red burrs with the power not more than 50%. Usually I move to 30%, sometimes to 20%. After that, you can also improve the margin using the sonic or ultrasonic tips. Because the ultrasonic or sonic tips, they do not rotate, so you can create much more smooth surface of your margin. Of course, for preparation you have to use just a 1 to 5 handpiece electric, not a turbine, because a turbine doesn't give you a stable torque and you cannot control the quality of your preparation. After that, we use rubbers just to remove the sharp angles from our teeth, because sharp angles are always a problem. They can create the stress moments for our constructions. When you use full ceramic, it's even more important. And the final stage is using the enamel chisel. Enamel chisel is the hand instrument that also we have 3 different sizes, 1 millimeter, 1.4 and 1.6. So they are the same as the burrs. So actually we get a one system. We have a burr, one size, and we have also the enamel chisel of the same size. So we have a clear protocol of step-by-step preparation. Enamel chisels helps us to create the most smooth margin as possible. There is no other instrument that can do this kind of the effect. So this is the final stage of our preparation. So let's get back to our patient and plan what we're gonna do. The first step is endodontic treatment, the treatment of root canals. The second step, the second visit, is first phase of preparation and the second phase of preparation.
Вже годину сонце її захищає і ховає у променях своїх мене. Вже годину тому заграла зоря, і здається, ніч назавжди про мене, назавжди про мене. Може, зорі ті дивні, що палають вночі, її очі холодні знайдуть за вікном. Може, голос твій тихий промовить мені, що луна лунає крізь промені. Вже годину сонце тебе захищає, тримає хова, ламає, гукає мене. Пам'ятаєш, як тоді нам грала зоря, і здавалося, що все назавжди, назавжди. Може, зорі це люди, які тільки будуть, і вони не забудуть тебе і мене. Якщо хочеш, все буде, якщо справді хочеш, ця ніч назавжди про мене. Вже годину сонце мовчить за вікном і ховає у променях своїх мене. Вже годину справу долаю вином, і здається, ніч назавжди про мене. Назавжди про мене. Назавжди про мене. Назавжди про мене. Здається, ця ніч назавжди про мене. Здається, ця ніч. Здається, ця ніч назавжди про мене. Здається, ця ніч назавжди, назавжди.
We can see that we try to be as invasive as possible. The width of the margin is approximately 0.4 millimeter. Let's look closer. Soft tissue is not injured, it's stable. We have the same sharpness and the same width of the margin all around, because on the palatal, when we prepare, we always use the mirror. Then we go with the provisionals. In this case, I just use the ProTemp. It's a bisacrylic material to create the direct provisionals, and the same, it was also the mock-up for the patient. So the patient could see the form, she could talk, so we could check the smile, or we could check the phonetic analysis and other details. We go on. Then after 1 week, when the patient comes back, I can see that the soft tissue is stable, and I can actually continue with the impression. I usually wait 1 week at least, because after 1 week I can see if there was some kind of recession. When we come to the impression, I use nowadays two kind of materials, polyethers and vinyl polystyrene. Why? Because these two kind of materials are very good, they are very precise, very stable. And for the retraction, I mostly use one cord, or it can be also double cord technique that I'm going to tell you about a little later. About the cords, as you know, some of them are impregnated. Just remember, if you use aluminum sulfate can block the polymerization of acetylsilicones, and epinephrine can also influence the polymerization of polyethers. So to be honest, nowadays I again don't use impregnated cords, and the margin must be perfectly polished before we take the impression, because sometimes if it is not polished and we take an impression, some elastomers can just tear off the impression. Those are just little details, of course, I agree, but we must remember that the success always consists of details. The protocol is more or less the same, but the details sometimes make difference. That's why we have to pay attention to these things. As I told you, I use one cord or two cords depending on the case. Usually, if I put one cord and I see that it's in the sulcus and the sulcus closed, then I move to two cords technique. But in this case, one cord was enough. Our main aims are vertical and horizontal retraction.
Це зі мною і одна, та не лірі падає стіна. Новий день, новий лайк, кожна пам'ять її клондайк, так на мене діє лиш вона. З нею кайф, з нею клас, так буває перший раз, з нею зовсім непомітний час. Це вона, це вона, це зі мною і до дна, і лунає з кожного вікна. Я знаю, це зі мною, я знаю, це вона, веде мене з собою, я п'ю її до дна. Я знаю, це зі мною, так дихає вона, і тілом відчуваю, прийшла моя весна. Є наснага, є час, наші все ще за нас. Будь така, як є, будь без прикрас. Кожен день, кожен лайк, це твій особистий страйк, але на прохання не наказ. Не лякайся, не плач, нам не позичати вдач. Я в її очах читаю все. Ей, мала, як сама, все, чого бажаєш нам, і лунає з кожного вікна. Я знаю, це зі мною, не було чекати. Я знаю, це вона, це вічно мене копати, веде мене з собою, це ніби вода у хату, я п'ю її до дна. Я знаю, це зі мною, ранку як спати, так дихає вона, дуже все до тепер, і тіло відчуваю, усе, на що вона здатна. Прийшла моя весна. Я знаю, це зі мною, не було чекати. Я знаю, це вона, це вічно мене копати, веде мене з собою, це ніби вода у хату, я п'ю її до дна. Я знаю, це зі мною, тримай, 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 так дихає вода, байдуже все до тепер, і тіло відчуваю, усе, на що вона здатна. Прийшла моя весна.
Magnification is really big advice because you can see all the details, you can see the problems, and if you see the problem, you have a chance to correct it doing one more impression. Team approach. Then when we have a nice impression, we have to pass it to our lab. As you can see, without a good lab, we cannot have a good result, because behind a good clinician, there is always a good technician. There cannot be a nice result only if the doctor is good. The dental lab must also be the same high level. I'm actually lucky in that point because my dental technician that I cooperate with is my father. This is also our family lab that's very close to our dental clinic, approximately 300 meters, so we are communicating quite good. It's very close. My father can always come and check the patient, and also even when he doesn't have time and we have to communicate through the internet, even though we are very close, the advice would be to use the same RGB profile. If I take a picture in sRGB profile, I have to send it to my father, who has the screen, who is working also in the sRGB profile, so we can see the picture, the same quality and the same color. It's very important. Then when the lab gets my impression, we started to use silvering. Silvering is one of the techniques to get the most precise model. What is it? We use the silver spray first, then we connect cathode and anode and use the special bath. We start creating the galvanics layer on our impression, as you can see on this slide. So what do we get? Take a look. This is the prepared tooth in the mouth, and this is the tooth on the model. So it's made of the metal. The surface is metal. Why do we need that? Because when we create this sharp margin, and if we have just a stone model and we work all the time on the same stone model, this kind of margin just disappears. That's why sometimes we get a problem when the crown comes to our office, to the dental office. We put it into the mouth and we can see that the crown is a little thinner and that the shoulder on the tooth is a little wider. That's the problem. And on the model, everything looks okay. It's because the stone model is not so stable. And when you have this metal margin, it's really stable and very sharp and precise. So you can gain the best precision ever actually on the market. So when we come to the choice of material, nowadays we have lots of materials, I think you all know, starting from composite, PFM, finishing with zirconium, finishing with the press ceramics and also full ceramic restorations. As you can see, the longevity of restorations, if they are done good, the composite should work approximately 5-8 years, bridge approximately 8-10 years, single crown approximately 12-15, and golden overlay about 15 years. Check what is the difference between bridge and single crowns. 4 or 5 years. I think this is the main reason, one of the main reasons why we have to try to work only with the single crowns, if it's possible.
Коли ти наодинці, всі навколо золотоординці, у чужій хатинці, ти наодинці і сам себе питаєш, що робити маєш. Ти наодинці, з ким говорити, кого слухати, сам собі Андрюха, ти наодинці, дні такі повільні. Алло, ну давай телефон мій, дзвони, дзвони, дзвони. Алло, ну де всі вони, де всі вони, yeah. Алло, ну давай телефон мій, дзвони, дзвони, дзвони. Алло, особистий Вавилон, when you're alone. Коли ти наодинці, все, що маєш, сміття твоє. Ти наодинці, хто ж тепер тобі настрій псує? Все, що лишив на потім, Мар'яни ти не попів, вогняну воду пил мій пив, та пам'яті не втопив. Алло, ну давай телефон мій, дзвони, дзвони, дзвони. Алло, ну де всі вони, де всі вони, yeah. Алло, ну давай телефон мій, дзвони, дзвони, дзвони.
Hello dear friends, my name is Nazaruk. I'm a dentist from Ukraine, doing mostly prosthodontics in my office. As you can see on this slide, I work in Ukraine. don't know, or we might not be so mostly prosthodontics in my office. As you can see on this slide, I work in Ukraine, western part, the western part, the city check. We also use orthophosphoric acid and sealant 3 times. So this is actually what we had at the beginning, as you remember. Then we went on with a wax up, the planning of our result, and this is what we got in the end. 3 full ceramic restorations and composite on the lateral incisors, but not for the pros. That's why for the then we go with the isolation excess. I use the rubber dam. This is my basic kit. I use the frontal split dam in this case. The medium rubber is not used by me almost ever, because medium is good for endodontics but not for the pros. That's why for the pros I always use the hard rubber, because I get much better retraction of the soft tissue of the lips and I have great access to the place where I work. We remove the provisionals. We see that the level of preparation now is in the sulcus, so we are not worried anymore. The soft tissue is stable. We check the crowns in the mouth. The width of the crowns is approximately 0.5 millimeters. Then we go on with the dentin preparation. For the bonding, we check the precision. I like this slide a lot because I think it's really important. It's called the dry fit. When we remove all the saliva and all the water from the surface of the tooth, and the same we do with the crown, and then we put the crown in the mouth, and with the magnification, with the biggest magnification in the microscope, we check the precision. As you can see, the precision is quite good. We don't have any problems, so we can continue with bonding. Then we go on with the preparation of our crown. We use fluoric acid, 10% for 90 seconds because it's a feldspatic ceramics. We also use orthophosphoric acid and sealant 3 times. So this is actually what we had at the beginning, as you remember. Then we went on with a wax up, the planning of our result, and this is what we got in the end. 3 full ceramic restorations and composite on the lateral incisor. Black and white to check the brightness. Of course, we're checking the soft tissue because nice teeth are not so important if we don't have the nice soft tissue. And when we have a nice soft tissue and beautiful teeth, I think we can consider a successful case. Projection to the lower lid before and after, and the smile of the patient before and after. This is the final result. So I hope that this lecture, this presentation was useful for you, and the details about preparation you can use in your daily practice in future. This approach with using the microscope is not only mine. I consider that every person who starts using the microscope or the loupes looks like this on their first day. Yeah, they are shocked, because when you start seeing that much information, we are kidding that you just start to remind about all those patients you had before, and you just wish them the good health and good luck. Because from this day and on, you will see more details, you will be more precise, and the quality of your work will become much better. That's why if you're not using magnification, I advise you to start. Your profession will become even more and more interesting for you, not just like a daily routine work. This is not just my philosophy, this is also the philosophy of my friend who is Maxim Belograd. He's also from Ukraine, and at the beginning of this year we created the group that is called Microvision, and nowadays we have a few members in our group like Irfea Saravia, Professor Moura, Glenn Vanas. You can also read about this group online, of course, and find us on Facebook. So this is our office, by the way, in Ukraine where we work. We have 3 dental chairs, we have a study room. Besides treating the patients, we also do many courses on different topics, but the main topic usually is preparation, the protocol of preparation for full crowns, for veneers, for onlays, overlays, and other details. So, dear friends, if you're actually interested in this topic, you're always welcome to our dental clinic and our study center. Thanks again. You can find me always on Facebook. Goodbye. Thank you.